but I'm really glad that you're here. You're probably wondering, based on the intro, what the heck is the great disconnect? What is this disconnect between dental teams and dental patients? Well, I got to tell you, it's very, very important, I think, for us as an industry to recognize this and really intentionally cross this. And that's why we did this new podcast focusing exclusively on how to put patients first. What do I mean? Well, we live in a world where 50% of dental patients don't see a dentist regularly, and 22% of all dental treatment gets delayed or put off indefinitely due to dental anxiety. So I think that we as a profession need to take a hard look in the mirror and say, this is not just a dental patient problem. This is an industry-wide problem, and that's what this podcast is about. And I wrote a book called The Patient First Manifesto. If you don't have a copy, if you go to patientfirstbook.com, you can get it for free. You just have to pay for shipping, and then you can get it for free. But it's about the same topic, and so really, it's resonated with a lot of dental professionals. They recognize what's going on, and I wanted to broaden this and really refocus an entire podcast on it. And it's been my honor to serve the dental industry in a lot of different ways. We had a podcast previously that really focused on the patient perspective, but this is really going to be focusing on how to build your practice by leveraging what I believe is the biggest opportunity, and that's tackling dental anxiety, switching the sails of your ship of your practice to adjust to the winds of change, of convenience, of immediacy that are just overwhelming the world right now, and we are behind. And I believe that if we really incorporate some key concepts, pretty basic, into our practices, we will grow faster, better, and we can really change the definition of quality of care to expand to include that patient experience. No longer is just being a great dentist good enough. It's essential. We need to have high quality care, but we also need to really focus on how do we meet the patient where they are. When again, it's quite shameful, frankly, that we live in a world where half the patients don't see a dentist regularly. Now, some other statistics from my book that I wanted to read because I don't have a very good memory, but there was a 20. This is from a 2014 Gallup poll that these are some things that people would rather do than undergo a dental procedure that prove the way people view getting a dental procedure done today. 33% of people polled would go without sex for a month versus having a dental procedure. 30% would spend a whole day a week at work. So they'd rather be a week at work versus getting a dental procedure. 19% would speak in front of a crowd of over 50 people. And the reason why that one's so important is that it's the greatest fear of 40% of Americans. So 40% of Americans, so half of those basically, if you think about it, would rather speak in front of a crowd than go to your office and have a dental procedure done. Why is that? We live in a world now where the technology and the way we deliver dentistry, pain has gone by the wayside. We really can manage pain, so it's all anxiety. And I feel like a lot of this just really comes down to our perception of how we deliver care and how we really don't address the patient's need. And there's another another story from my book that I'm going to relay. I'll paraphrase, where it's really about two monks that are walking down a street. There's an older monk and a younger monk, and they come across another monk who's been incapacitated because a tree fell on him. So the fallen monk he's crying and he's in pain and he can't move. So the younger monk who was walking down the path freaks out. His brother's in pain. He's crying. He goes over to help him and he pulls on him, which then just digs the tree into his leg harder. And they're both wailing and screaming. Whereas the younger monk doesn't seem to care as much, but he goes over, grabs another log and a rock and pries the fallen tree off the other monk, and they bring him back to the monastery, and everybody's on their way, and the fallen monk is getting the care that he needs. And later on, the younger monk says to the older monk, I mean, I'm much stronger than you, but I couldn't free him. Why were you able to help our friend out? And the older monk says, look, you wanted to help our friend, but You became incapacitated due to absorbing, being you were empathetic and absorbed our brother's pain. And that incapacitated you from helping him. Whereas I was compassionate. I felt his pain, but I didn't internalize it. So I was able to react and help our friend out. How does that apply to dentistry? Well, I believe that it's the origin of what I call the great disconnect between dental teams and dental patients. Most of us in dentistry went into dentistry for a very simple reason. We wanted to help people. Well, when you help people who are anxious and in pain all day, and if you're empathetic, you're going to absorb that pain. And what that does is it reduces your ability to actually perform the small procedures, the small surgeries we're doing all day long. All day, every day, we're in nanometers. We've got, shades that are, 150 shades, let's face it. We've got angulations of root. We have occlusion that's like, the width of a hair makes a difference. So we work in this exacting environment, yet we do this on somebody that's flopping around because they're anxious and afraid. Now, there's the natural tendency is either going to be to absorb that pain and really be worse at our job, or to completely shut that pain out, to that anxiety out, and disconnect ourselves from our patients. That's what the great disconnect is. And I believe it is the origin of why dental teams and dental patients look at dental care differently. So, what do we do about it? I think we have to intentionally understand what's going on and really burn the calories, do the work to adjust our perspective to the patient's perspective so that we can then help them out without incapacitating ourselves. And that is not easy to do. It requires intention, it requires focus, and it requires repetition. And so this podcast is about how do we do this? How do we bridge the great disconnect? How do we make it so that people are excited to go to the dentist? I have a filling, I have a hole in my tooth that bums me out. I want this taken care of. I would rather do that than go on the boat today. Rather than having 19% of people rather have one of their biggest fears getting in front of a group of people to speak, we should look to say, I would rather go to the dentist and get my teeth repaired than anything else, right? Think about a world what that world would look like. I just said at the top of the show that 22% of patients have delayed their dental treatment due to anxiety. That means that if we can do this right, your production will go up 22%. 22% just on that alone, let alone the other 50% of people that don't come into our practices. It helps everybody out. It's what I believe that we in the industry should be solely focused on, is transforming the patient perspective about dentistry. No longer is the quality of care just your margins. That's a given. Bonding now is easy. Aesthetics, much easier. Not to discount the effort that it takes to get quality dentistry done, but let's face it, our quality of dentistry has far exceeded what the patient believes to be quality care. So I think it's vitally important for us to expand now. We need to keep and honor and really focus on high quality care, but we also need to look at and deliver this quality care in a way that more patients want to receive it. And that's what this is about. So I'm very excited that you're here. The dentists, the dental team members, even the patients that are listening, there's not that many people in the world that are engaged, that are looking to improve themselves every day, that listen to podcasts, that watch YouTube videos, a way to level up their skills. And that's the other really thing that I'm passionate about, is helping people who are truly engaged, who want to help patients, that want to grow their practices and do it in a way where everybody wins. That's what it's all about, right? And so to that end, we on this podcast are going to be having some regular segments. We're going to have some amazing guests. I'm really excited for the people that we have lined up. I'm lucky to know pretty much everybody in dentistry. Everybody that I think really is working hard to move the needle in a positive direction. And so I'm just floored by the people that we're going to be having on the podcast to bring some really great perspectives to you. But we will also have some recurring segments, which I'm excited about, because I think that there are some things that I've noticed, particularly coming out of the pandemic, that I think if we were ahead of it, or at least on top of it, it would help everybody's practice. Number one is what we're calling the KDI, the key dental indicator. What does that mean? Well, right now in August of 2021, I believe the key dental indicator is the retention of your employees. Somewhere around 10%. Some people say more, some people say less of the dental teams have fled the industry, right? Our boards, our associations, I don't think are doing enough to expand and make it easier for us to replace that 10%. So for the foreseeable future, I think that we're going to be in a situation in dentistry where retaining your employees is going to be crucial, right? So we'll have a segment on that and how to attract, retain employees. I think you'll love that. But that's what this recurring segment is going to be. Because through the pandemic, I noticed that like every single day there was a burning hot issue that somebody should be addressing. And you can either go out and search for it all, or you can just come here to the Patient First podcast every week, and we will talk about that issue, particularly the issues that are burning hot issues that you need to be aware of in dentistry. It's the KDI. We're going to have a segment on finances in dentistry. Again, another thing that kind of flips around and goes up and down, everything from if there's something you need to know about a stock in dentistry, about financing, about taking out loans, PPE, reimbursements. We had the emergency disaster loans throughout the pandemic. Anything with finances, because that's not something that most dentists are paying close attention to. And so I want to bring you what you need to know about finances in dentistry. Also, if you know me, if anybody who knows me knows that this is my specialty, dental technology. So we'll have a dental tech update. There's so much cool stuff going on in dentistry right now, and I'm lucky to be parts of it, or at least alongside of it, or working with the people that are doing some really cool things in technology in dentistry. And it's not just clinical technologies. It's interoperability. It's robotics. There's some really neat things that you can leverage. And I think there's a misconception in dentistry that technology has to be big, expensive. No, if you've read my book, again, The Patient First Manifesto, you know that one of my favorite pieces of technology in my office is my coffee pot. Why is it one of my favorites? Because it's my patient's favorite. They mention it all the time. It's the first story in the book about we get a 5-star review. I won't go into it because if you want to read the book, it's I'm kind of I guess I'm spoiling it already. But realistically, technology does not need to be a $150,000 CAD CAM unit or CT. It can be; those are great things. The CT imaging machine. It can be the smaller things, the things that unburden your team members, or even emerging technologies. Things that make the patient more comfortable. And we will have a regular update on technology in dentistry. And lastly, one that I'm really excited about: books applied to dentistry. I think that there are a lot of great books coming out. I'm part of some entrepreneurial groups where we discuss books all of the time. And I think that one of the things that I see missing is someone taking that book that came out that has maybe have a good nugget of either it's a leadership or management or some type of how to run your business or customer experience or whatever it is, and really apply it to your practice, because there is some nuances to dentistry. And so what I'm going to try to do is to bring in external knowledge from books and then apply it to dentistry. And sometimes we'll have the authors on and do a little Q&A, which will be fun. So next week for our second Patient First podcast, that's funny, this second Patient First podcast, I like it. We're going to have our first book applied to dentistry, which is going to be a great book called Effortless. So we're going to be doing The Effortless Dentist. The author of Effortless is Greg McKeon. So if you want to do a little extra credit, you can read that book. It's a pretty quick read between now and next week. And I look forward to seeing you then. Thank you very much.